cancer is a good cancer to get, but pancreatic cancer is especially bad. The chances of surviving it aren't great, but there's a new treatment that's offering hope. Here's health editor Dr. Maria Simbra.
Leslie Weinberg exercised every day, maintained her weight, and took good care of herself. When she developed belly pain and couldn't eat, she saw her doctor right away. A CT and MRI showed the problem. It was cancer of the pancreas, a gland just under the stomach, important to digestion and nutrient processing. The tumor was tangled in the blood vessels, and she was told it was inoperable. The diagnosis brought Leslie to her knees.
I went straight to my church and was anointed, and I prayed that God would go before me in every step, and that He would give me the miracle that I needed, and that He would direct me to the best care.
Leslie was treated with chemotherapy and radiation. Patients will do well at first, but generally the cancer will become resistant to the chemo and the disease progresses or spreads. Even with chemo and radiation, life expectancy is only 6 months to a year. With no other options to fight the locally advanced cancer, her doctors ended up sending her for a new procedure called irreversible electroporation. Dr. Suzanne Schiffman trained with the doctor who developed the technique, which has only been done on several hundred patients.
They were able to actually increase survival to almost 2 years in some patients.
The doctors use small incisions and ultrasound guidance to target the tumor.
We placed these long needle probes to bracket the tumor. The probes give very high voltage, low current pulses, and that effectively causes the tumor cells to develop pores, and then they actually undergo cell death.
This can be done along with other treatments and with tumors close to blood vessels. It's best for tumors smaller than 4 centimeters and in young, otherwise healthy patients. It's not for people with heart problems, since the high voltage pulses can cause cardiac complications.
It was a new procedure, and she was very frank with me that I would be the first candidate for the procedure, and that was very frightening.
Leslie had her procedure in April.
I'm doing great.
Even so, she's cautious.
There is that chance that my cancer can return.
Most of all, she's grateful.
It has bought me time, time that we all take for granted, and I have every reason to appreciate now every minute of every day. It was hope that I never had.
I'm Dr. Maria Simbra, KDKA-TV News.